As an expectant mother, it can be overwhelming to prepare for the birth of your baby. Your recovery may be the last thing on your mind, but it's an essential component to your continued well-being. By the end of this video, you'll know what to expect for your cesarean birth recovery. Hi, my name is Kelsey Harms, and I'm a licensed physical therapist in Birmingham, Alabama, who specializes in treating the pelvic floor. As a pelvic floor physical therapist, I treat women through all stages of life, starting from postpartum care all the way to incontinence issues down the line that may present. Proper cesarean or C-section recovery after birth is essential to your overall well-being. Today I want to cover a few things with you. What are the types of C-sections? What are some symptoms you may experience afterwards and some tips for recovery? And also, how can PT help with your journey? So the first thing I want to talk about is what is a C-section and what does that procedure actually look like, as most of us have heard of the term but may not necessarily know what happens during that procedure. So first they'll do a horizontal incision along the abdomen. When they reach your abdominal wall, specifically the rectus abdominal muscle, they will separate those muscles and pull them to the side. At that point, they'll typically create a horizontal incision along the uterus so that they're able to access the baby and remove the baby. There is planned cesarean births and there are emergent cesarean births. With a planned C-section, this can typically be for multiple reasons. If a mother is giving birth to multiples, if the baby is in a suboptimal position, such as a breech position, if there are other comorbidities such as placenta previa, which would be where the placenta is covering the cervix or the opening where the baby would be delivered vaginally. Other reasons can include preeclampsia or gestational hypertension or macrosomia, which would be exceptionally large size of the baby. An emergency C-section occurs when there are complications during labor or the birthing process. Some things that can be included in that may include stalling of labor, so a mother isn't progressing as expected or it's been too long since the water broke. If the baby is in fetal distress, so they do a lot of monitoring throughout the birth process if there's any drop in heart rate. An emergency C-section can also take place in the event of maternal distress, such as in the instance of a uterine rupture or significant loss of blood. The number one goal of any birth, whether vaginal or cesarean, is to get the baby out safely and have a healthy mama on the other side as well. Some common physical symptoms you may experience after a C-section include tenderness and swelling along that abdominal scar. During the event of an unplanned C-section, if you experienced any labor or prolonged pushing time, things like that, you may also experience that swelling and soreness in the vaginal area too. When you have a C-section, they also use a catheter in that urethral opening. So it's very common to have some vaginal discomfort or burning, even if we didn't have the vaginal trauma that happens during a vaginal delivery. Some other post-operative symptoms can include bloating, gas pain, and constipation, which can all be very common due to the anesthesia and things that you have to go through during surgery. There can also be some emotional symptoms that you'll want to look out for after any type of birth, but especially if maybe your birth didn't go the way you planned. Some things you'll want to look out for are baby blues, which are typically sudden changes in your emotions and feeling of sadness immediately after birth, and then postpartum depression, which can last longer and can also start up later on in your recovery journey. If you feel that you may be experiencing symptoms of postpartum depression or anxiety, I encourage you to reach out to your healthcare provider for further treatment. I want to go over a couple recovery tips for you. So first of all, one of the most important ones I think is to listen to your body. If you feel like you may be overdoing something, that can be a sign to step back and take it easy. Some things you'll be looking for are pain, increased bleeding, soreness along the abdomen. Those may be signs that you're doing a little bit too much early on. It can be important to get up and start moving early on as soon as you're cleared from your doctor, same day of surgery. And that can be as simple as going to the bathroom with assistance from your nurse if you need it, to sitting on the edge of the bed and extending your legs just to get the blood flow moving, to also start and kickstart some of that gastric motility to prevent any of that constipation that we talked about earlier. Another tip will be to avoid any excessive heavy lifting. So this is going to be anything heavier than your baby, really. And what can be really helpful is to have your partner or other support person in your life to help set you up and hand the baby to you, so you're not having to do a lot of bending and lifting if you're home, if that's available for you. Some common post-surgery guidelines that you'll see include limiting your driving for that first couple of weeks, specifically if you're continuing to take narcotics for pain management after your surgery. Limit sexual activity for that first 6 weeks as we still have that incision in the uterus and we allow for all of that healing to occur. Your care provider may also have you limit vigorous activity in that early postpartum phase, but typically returning to walking and doing some gentle mobility is good for you. As far as incisional care, your doctor or care team should go over procedures and what that looks like after your surgery. Some common tips are going to include keeping the area dry and clean and watching for symptoms of infection, including redness, swelling, excessive bleeding, or peeling away at the ends of those incisions. In the event of an unplanned C-section, you often may have some of the common symptoms that occur after a vaginal delivery as well, especially if you had any type of prolonged pushing or contractions. Ice packs can be typically helpful for that, and also the use of a peri bottle. Physical therapy can be a huge component to your recovery after a cesarean birth. Some things that we focus on are retraining some of those core muscles, waking them back up after they've gone through major abdominal surgery. We'll focus on scar mobility. So whether that's even just making you more comfortable with pressure on your scar, including clothing touching that scar line, to more aggressive mobilization down the line to make sure we're not having any adhesions or lasting discomfort from that incision site. We'll focus on improving core strength, regaining your mobility, and how to move functionally with your baby and prevent things like back pain, hip pain, and any other dysfunction that may appear after delivery. A typical course of treatment will look like you coming in. That first day, it's a lot of talking with your therapist so we can really understand what your goals are and what are the things that you're hoping to achieve after birth. Your physical therapist will give you a lot of education, a lot of the things we talked about today, and also what you can expect as you progress throughout your journey. We'll typically give you some things to work on at home for your home exercises, whether it might be as simple as beginning some breathing process to that scar mobilization, and we'll eventually progress those to where hopefully we're getting back to your preferred form of exercise. Recovering from a cesarean birth can be a multifaceted journey with a lot of changes happening physically and emotionally during this time in your life. We understand that it can be challenging to take care of yourself while you've got a new baby at home and a lot of new things to figure out in your day-to-day routine. However, as you navigate this period, it's crucial to take proactive steps towards your recovery. We've put together a guide with some information on how to properly start caring for that C-section scar at home. Click the link in the description below to download our C-section scar adhesion care guide. This guide reviews soft tissue and scar mobilization strategies through every stage of your recovery to allow you to heal properly.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.